I want to start with your view as to what the current testing capability and situation is in Australia, because we heard from the Prime Minister and the Chief Medical Officer overnight saying that compared to South Korea, we are doing a lot more testing. In fact, really kind of talking up how progressive and how capable the testing ability in Australia has. But anecdotally, you hear from so many people that even though there's community transmission going on, that the barrier to get tested is still very high. What are your views?
I think the government here in Australia has been proactive in testing, and testing rates have been, by international standards, quite high. I think the challenge is that RNA-based molecular testing in laboratories is limited by the capacity of the throughput of the machines and also the availability of reagents. So there's a finite limit to how many tests can be done through pathology, and that's where I think rapid testing can play an important part.
Tell me about the state of development with these rapid tests. We know that they're commonplace when it comes to HIV testing, for example. How would it work for coronavirus, and how close are we as really the public as well as, therapeutics, healthcare professionals, a world are really kind of hoping for a magic answer to this?
Yeah, so the technology behind rapid testing has been around for quite a while, and over the last few months, diagnostic companies have been working rapidly to put a coronavirus antibody chemistry test onto the platform, and they're now starting to go through emergency use approvals and evaluations, and I think we'll start to see them come to market quite quickly. Atomo is looking in partnership with a number of international companies to bring some tests to market in a matter of weeks, not months.
John, how do these work? I mean, how quickly are we talking about in terms of getting some of the rapid test results back?
Yeah, so antibody rapid tests on lateral flow format typically deliver a result within 10 to 15 minutes from whole blood fingerstick samples. So a very quick point of care test, and certainly avoids the need for a return visit to a facility or for a long wait for a result. So I think it's very important for identification and isolation of positive patients.
Do you think we could get mass testing not only in your Australia, but in my USA as well?
Yeah, no, I believe that's very much our goal, and I think healthcare providers see the benefit in mass screening for identification and for follow-up. Atomo has both a professional use and self-test HIV solution that's approved in Australia and also by the World Health Organization, and that device easily supports COVID-19 testing, and we'd be looking to bring it to market in volume as quickly as we can, subject to approvals and supply chain scale up.
What do you need in order to bring it to market and really scale up? Do you need additional funding? Who are some of the partners that you're speaking with?
Yeah, we've been approached by diagnostic companies in China, Europe, and the US. We're working with several. We are actively scaling up our capacity. We have 300,000 devices already in stock that we've earmarked for these partnerships. We're looking to quadruple our capacity through the year. So we are working very actively to scale it up. We're really at this stage limited by scale, and we'll be looking to move as fast as we can with the ramp up of the availability of the cassette, so we can partner with several different companies in different regions to make sure that our innovative award-winning device can be available globally, not just here in Australia.
John, we know that standard PCR testing is pretty accurate, incredibly accurate actually, but is also very, labour and resource intensive and takes time. Hence, we've seen the hold-up in a number of different countries, despite really healthcare professionals saying we need to test more widely, and test more quickly. So the rapid self-testing, how does it sit in terms of accuracy? Because we've had, obviously the big, I guess, false success stories like Theranos looking at using just finger prick, a tiny amount of tissue to be able to get an accurate result.
Yeah, well, rapid tests have improved dramatically in the last couple of years, and our device removes a lot of the user error, which is why it's suitable for self-test use. Our HIV test, for example, is 99.8% sensitive for detection of positives. The results that I've seen for COVID-19 rapid tests, the sensitivity ranges from the high 80s to the high 90s, so they are accurate. They have a slightly longer window of detection than PCR tests, which means that for the first week, there's a likelihood more missed positives, but after that week's over, the accuracy is very, very robust. But more importantly, the test can be deployed without the need for extensive equipment. It can be deployed without the need for extensive healthcare worker support. So it's a much more flexible solution to get into community-based screening and clinic screening.
John, it's also interesting that you're backed by the Bill and Melinda Gates Foundations, their global health investment fund. What have your conversations been like with their health initiative, with Bill and Melinda Gates specifically? We do know that Bill, for example, stepped down completely from Microsoft's board to focus on some of these philanthropic efforts. What have those conversations been like?
Yeah, we received grant support previously from the foundation for our HIV self-test that we've now licensed to Mylan Pharmaceutical. We have had ongoing support from the Global Health Investment Fund. Their managing partner, Kurt Nobel, in New York is on our board, and they have been very supportive of our efforts in global health and continue to be very supportive through this IPO process, and with particular focus on our move now into the deployment of our technology in COVID-19 to help the pandemic response.
John, how close are we to be able to get a test for not just the infection, but immunity? Because that's going to be key going forward in terms of reopening the economy and getting people back to work safely.
Well, one of the advantages of rapid antibody tests is that antibody response stays in the system long after the infection has been cleared. So the problem with molecular tests is that once the viral load in the body reduces, those tests become less accurate. So what antibody tests can do is help post the first wave of infection, screen for people who've been infected and possibly have now immunity but weren't symptomatic at the time. So I think it's very good for follow-up epidemiology and surveillance programs.
How complex is the science at this point in terms of what we know about the coronavirus and what we don't know? Because it seems like it's a pretty kind of moving target, right? There's not even a great deal of clarity as to whether the 14-day isolation is necessarily sufficient, given that we have seen sort of outlier cases where after 14 days they're still infectious, or they've tested negative and then they've tested positive again.
I think the problem is that people's autoimmune response and antibody response varies greatly, and some people are symptomatic much quicker, and some people not symptomatic at all. So I think the 14 days, my understanding has been set as a point in the cycle to capture as many people as is practical. There may be a few people that are beyond that 14-day window, but I think 14 days is considered generally to be a workable number in terms of ensuring isolation is effective.